Good morning, everyone. This is Dr. YouTube here. In this episode, I will talk through the anatomy and physiology of the pituitary gland. I'm a hormone doctor. I have a revision website useful for medical, nursing, and allied healthcare professionals, including pharmacists, physiotherapists, etc. So it's a medic4u.webs.com and medics4u.webs.com. So the pituitary gland, well, it is a gland that sits in the head, and you've got, first of all, anatomy. You've got your anterior, okay, and posterior pituitary gland. The anterior pituitary relies on portal vessels, so AP, that's how I remember it. Posterior, on the other hand, relies on axons or nerves, PA. So AP, anterior, pituitary, P for portal vessels, and PA, A, posterior, relying on axons, right? So you've got your anterior, hypophysis, and your posterior hypophysis. So that's posterior relying on nerves, remember, PA. So these nerves come from where? The hypothalamus. The hypothalamus sits on top. Now there is a direct connection between the hypothalamus and the posterior pituitary gland. Okay, as you can see here. Now, what are the cell types of the pituitary gland? The way I remember this is A, B, C. So you've got your acidophil for A, B is basophil, and C is for chromophobe. And basically, these are basically cell stains. Different cell types stain differently. How I remember them? Well, basically the acidophil, they secrete two hormones. One is GH, so growth hormone. The other is prolactin. Basophil, on the other hand, secretes SAT, so sex hormone, FSH, LH, is S, A is for ACTH, and T is for TSH. Fine, so that's anterior pituitary gland. Okay, you've got your ABC cells. A, acidophil, GH, prolactin, B is basophil, secreting SAT, so FSH, LH, ACTH, and TSH. And finally, you've got your chromophobe. Now, let's look at physiology. You've got your hypothalamus, remember, they sits above the pituitary gland with direct connection with the neural hypophysis, posterior pituitary gland, remember here. Okay, so hypothalamus secretes GnRH, gonadotrophin-releasing hormone. This stimulates the pituitary gland to produce FSH, follicular stimulating hormone, and LH. I'm not quite sure how you pronounce it, but I believe it's luteinizing hormone. Now, FSH stimulates in the testes to produce inhibin. In males and in females, stimulates the ovaries to produce inhibin. Now, inhibin is like the brake system. It inhibits FSH release, so it goes back to the pituitary to act on and inhibit FSH release. LH, on the other hand, is what we all most commonly know stimulates the testes to produce testosterone via Leydig cells, and in females, LH stimulates the ovaries to produce estradiol. Estradiol and testosterone is what produces the, as we know, the sexual characteristic of both males and females. So let's revisit physiology. Hypothalamus produce GnRH. GnRH, gonadotrophin, stimulates the pituitary gland. Pituitary gland secretes FSH and LH. FSH stimulates inhibin release. And remember, inhibin is like the brake system. It goes back as a feedback loop to inhibit FSH release. And for the pituitary, the LH in males stimulates the Leydig cells, okay, Leydig cells to produce testosterone in males, and in the female, the LH stimulates the ovaries to produce estradiol. So I hope you found this video helpful. Mnemonics, remember, AP, anterior pituitary, okay, relies on portal vessels, and posterior pituitary relies on axons. And then A, P, P, A, and you've got your ABC cells, acidophil, basophil, and chromophobe. Remember about the feedback loop, and all the hormones will take care of you. Stay safe, and let's make sure our hormone systems are working. Take care.